In principle, it's a project of using these kind of wearable devices to collect environmental or aerial exposure of particles and microbes. So the device is in principle an air bump which collects different type of particles in a filter, and then we deep sequence that, so it's sequence data. And because we follow, so we have a longitudinal data, so the amount of data is enormous regarding sequence data. So traditionally we use different computing clusters in research institutes, and that's where you can run the large sequencing data sets. But in Hopsworks is a platform where you can not only speed up some of your analysis, but the capacity to handle quickly a large data sets is a good improvement. Yes. So it's different type of computer programs to control the quality of your data, and then pulling out the signals what we are interested about the sequence data, basically. As you mentioned, it's a pilot project in the sense that not many this type of research designs has been done so far. Exposome is a new concept in research. So what we're aiming is that with these devices we do a proof of concept showing that yes, we can follow our exposures using these devices, and yes, we have systems to handle the enormous amount of data to analyze it. One of the unique combination is that with this new type of sequence data where you can trace some of your exposures which we couldn't analyze earlier, then we can also combine it with the more traditional epidemiological data sets or data what is normally collected in clinical work, which we also have, and in many research institutes and researchers have already for years collected this type of case cohort data. So combining both type of data sets, which is one of the aim of in HEAP, that will probably tell us a lot more about what is the effect of exposures to our health. Even though the pilot designs are rather small in size, as I said, it's proof of concept. Mm-hmm. But one research question what we have is that what is the effect of microbe and molecule exposure to pregnancy? As we know that there's a lot of complications in pregnancies, and we're trying to sort of show that with the current methods, we are able to trace that what might be the effect of exposures.